Career in Aging, Dietitian. Dietitians work with patients to improve their diet to lose weight or to improve their diet in accordance with health-related conditions. Through our study of the Blue Zones, we learned the importance of diet in healthy and successful aging. This correlation makes the role of a dietitian very important in the care of an older adult.
Advances in chemistry in the 19th century led to the development of the profession of the dietitian. Early research focused on deficiencies, such as vitamins and minerals. The profession then developed a focus on daily requirements of protein, fat, and carbohydrates. World War II was significant in that the military emphasized the importance of diet. Today, there's a growing public interest in nutrition and the potential of food as a way to prevent diet-related diseases and conditions. This has led to an increased need for dietitians. In order to become a registered dietitian, one must have a bachelor's degree. It's recommended that this degree is in public health nutrition, dietetics, or clinical nutrition. One must also complete an ASCEND accredited supervised practice program or internship for approximately 6 to 12 months, and it usually occurs at a healthcare facility, community agency, or food service corporation. One must also then pass the national registration exam. Throughout a career as a dietitian, you must meet the continuing professional education requirements as well. A registered dietitian can choose to specialize in a certain area through certification, which occurs through the CDR credentialing agency. Such specializations include pediatric or renal nutrition, sports dietetics, and nutrition support and diabetes education. A common misconception is that dietitians and nutritionists are the same. A dietitian requires a bachelor's degree, a dietetic internship, passage of the national exam, and they are licensed to practice diet and nutritional consultation. However, a nutritionist has no required qualifications and is a self-proclaimed title. Therefore, all dietitians are nutritionists, but not all nutritionists are dietitians.
Becoming a registered dietitian has been growing in popularity in both the United States and globally. There is a program called the International Confederation of Dietetic Associations, or ICDA, that promotes and keeps track of the dietitian career worldwide. The mission statements of the ICDA include creating an integrated communication system, an enhanced image for the profession, and increasing awareness of standards of education, training, and practice in dietetics. A study performed by the ICDA in 2012 found that from 2000 to 2012, the number of countries reporting working dietitians rose from 31 to 43. There has not been any studies performed since then, but the number was expected to continue growing. A trend seen by the ICDA was that less developed countries tended to lack dietitians due to dietetics not yet being a recognized profession and lack of available schooling. There are multiple concepts and theories that we have spoken about in class that align with being a dietitian. The free radical theory is centered around the idea that aging is the cumulative result of oxidative damage to the cells and tissues of the body. Dietitians work with patients on their everyday diets, and by leading them to consume less calories and adjusting their antioxidant intake, dietitians can potentially help lower the effects of free radicals on the aging process. Another important concept that we have focused on in class are the results from the Blue Zones. Through reading the Blue Zones, we learned that people that consume little to no meat, less calories, and overall have a healthy diet tend to live longer and healthier lives. This concept again falls under the scope of a registered dietitian's practice. Overall, dietitians tend to follow a more holistic or preventative model of healthcare. This means that they work to prevent issues from arising rather than trying to fix them after they have happened. They can work with patients to help ensure that they are eating properly in order to try to prevent certain chronic illnesses later in life, such as diabetes. The duties of a dietitian fall mostly under primary prevention, but can include secondary or tertiary when needed.
The responsibilities of dietitians include assessing patients' health needs and diet, consulting with patients and clients on nutrition issues and healthy dietary choices, and developing meal plans that consider the cost and clients' preferences. Dietitians also write reports to document patients' progress and keep up with the latest nutritional science research. Clinical dietitians in hospitals focus on creating a healthy diet that can manage the symptoms of a disease or chronic condition of the patients. They also design nutrition programs to protect health, prevent allergic reactions, and alleviate the symptoms of many types of disease. Clinical dietitians assess patients' nutritional needs, develop nutrition programs, and evaluate the results. They work with doctors and other healthcare professionals to coordinate medical and dietary needs. Some clinical dietitians specialize in the management of diabetes and obesity.
Dietitians are commonly part of the healthcare team, and they work with other healthcare providers to improve the health of their patients with their knowledge of nutrition and how it applies to various illnesses and lifestyles. There is a large variety of job opportunities for dietitians, and these options include clinical dietitians who typically work in hospitals, nursing homes, or long-term care facilities, community dietitians who work with public health agencies to benefit communities, food service or management business dietitians that work with larger corporations, neonatal and pediatric dietitians work with children from birth through their teenage years, research dietitians, consultant dietitians who work privately with various groups of people, and geriatric dietitians who work with the aging population. We wanted to focus on geriatric dietitians and how they work hand in hand with the aging population. Geriatric dietitians are typically found in hospitals, nursing homes, or other long-term care facilities that have a population of older adults. It is important for dietitians to work with the aging population in order to promote successful aging. This is because older adults should meet specific diet requirements due to the natural diminishing metabolic rates that occur throughout the aging process. Geriatric dietitians often work closely with older adults that have chronic illnesses such as diabetes or osteoarthritis, since diet is an important part of their overall plan of care. Geriatric dietitians may also be educators for doctors, nurses, and other healthcare providers, as well as patients and patients' families, in order to correct and/or maintain the dietary needs of the aging population.
The health sector faces unique challenges from the aging population, more specifically from the chronic diseases and non-communicable diseases that are common in the population. Diseases such as diabetes and CVD, along with issues related to obesity, are common factors that may result in premature death. The availability of dietitians is instrumental in combating such cases due to their focus on decreasing tobacco and cigarette usage, harmful alcohol consumption, and conveying unhealthy eating habits as well as inadequate physical activity. Many of these are especially important when considering the older population that may be in need of advice on how to positively change their routines. Dietitians mainly contribute to issues of global aging by having a positive impact on many of the common causes for premature death by promoting healthier eating habits and lifestyles. This includes decreasing smoking and alcohol consumptions, promoting daily exercise, and introducing healthier diets.
Recently, there have been a growing number of dietitians becoming social justice advocates in the field of dietetics. The issues they focus on include food insecurity, climate change, world hunger, income inequality, gender inequality, and food sustainability. These issues all have connections to current economic, social, political, and environmental issues that our society faces. Specifically in the care of older adult patients, dietitians can serve as social justice advocates for older adults who have lower socioeconomic status, are unable to secure reliable sources of food to meet their nutritional needs, or those whose incomes suffer as a result of the gender wage gap. All of these circumstances can leave an older adult vulnerable to not getting proper nutrition. Dietitians being aware of these issues and forming movements such as critical dietetics, which encourages dietitians to become more involved in social justice issues, can help to significantly improve older adults' food situation, which will overall improve their quality of life and reduce these possible stressors of retirement. Now it is time for some review questions. We will test your knowledge on dietitians and their care for the aging population.
Which individual would be the ideal healthcare provider to consult with a patient recently diagnosed with type 2 diabetes? A. Nutritionist, B. CNA, C. Dietitian, or D. Personal chef? The answer is C. Dietitian.
What qualifications does someone need to become a dietitian? A. Bachelor's degree, B. Dietetic internship, C. Passing the national registration exam, or D. All of the above. In order to be a qualified dietitian, you need D, all of the above, a bachelor's degree, a dietetic internship, and passing the national registration exam. True or false? Every dietitian can call themselves a nutritionist, but not every nutritionist can call themselves a dietitian. True. Every dietitian can call themselves a nutritionist, but not every nutritionist can call themselves a dietitian.